Hi everyone, my name is Lai Chaiwan and my number metric is D2023 110673. Today I want to talk with you about oppositional deviant disorder. What is this? According to National Library of Medicine, oppositional deviant disorder (ODD) is a type of childhood destructive behaviors that usually includes problem with self-control regarding emotions and behavior. It is mostly diagnosed in childhood, but childhood ODD can continue into late adolescence and adulthood, especially when it goes undiagnosed untreated. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition DSM-5, the main feature of ODD is a persistent pattern of angry or irritable mood, argumentative or deviant behavior, or vindictiveness towards others. Let's now to see what is the example of oppositional deviant disorder.
You lost your Wii. You will not have it tomorrow, and you will not have the TV.
You are not going to tell me boss around.
I will.
Get the gun. If you don't shut the fuck up.
One,
Don't shut the fuck up.
2, go.
Shut up.
You need to calm down.
Are you okay?
Let's go.
Now we look to the prevalence of oppositional deviant disorder. Some studies estimate that are as many as 5.6% that affected thousands of children worldwide, and the American Academy of Child and Adolescent Psychiatry estimates 10.2% of kids are found in ODD. Male prevalence of oppositional deviant disorder is higher than female, which is 6.8%, while female prevalence is 4.3%. Signs of ODD. To be diagnosed with ODD, a person must display at least 4 of these symptoms for 6 months or longer. For example, blame others for their misconduct of mistakes, frequently refusing adult requests or rules, often touched or easily annoyed, are disciplined at school frequently but not at home, often angry and resentful, are spiteful and vindictive, lose their temper often. It is often challenging for caretakers and educators to deal with kids who suffer from this disorder. The level of ODD can be divided into 3, which is mild, moderate, and severe. Causes and risk factors. In order to prevent this, we need to understand what might cause the oppositional deviant disorder. First, environmental factor. Childhood maltreatment and harsh, inconsistent parenting are commonly found in families of children with ODD. Second, genetic factor. The heritability of ODD is around 50%, and there is a substantial genetic overlap with conduct disorder. Genetic factor is the most important factors in any disorder in early formative years. For example, women who use toxic substances such as alcohol during pregnancy are more likely to have children who are developed oppositional deviant disorder. Third, psychological factors. Temperamental factors such as irritability, impulsivity, poor frustration tolerance, and high level of emotional reactivity are commonly associated with ODD. ODD occur also related to social learning. Children who live in aggressive, constantly fighting family or family member, home where rules are not clearly stated, will cause them to reproducing their inappropriate behavior. Intervention. Any child that shows symptoms of oppositional deviant disorder needs appropriate treatment. According to PhD Douglas Lilly, oppositional kids are also often quite engaging and bright. They tend to be optimistic and very much their own person, with their own way of looking at the world. Once you work through their deviance, there's a lot there to like. Pharmacologic therapy. As psychosocial interventions are the first-line treatment for children with ODD. Pharmacologic agents is typically reserved for cases in which aggressive and destructive behaviors cannot be managed by the above treatment modalities alone. Treatment of comorbidities is paramount and should be the first option considered, and the potential burden of side effects carefully. Stimulants include methylphenidate are helpful in cases of comorbid ADHD, and non-stimulants such as atomoxetine, warfarin, and clonidine also have beneficial effect. Medication therapy. Research has found that mood stabilizers, classic or non-classic antipsychotic drugs, risperidone and warfarin, have certain efficacy of oppositional deviant disorder. However, there's a few clinical randomized controlled trials studying the efficacy of medication. For children with significant impulsivity and aggressive behaviors, traditional antipsychotic drugs such as haloperidol were previously used. However, more recently, low-dose risperidone, quetiapine, and olanzapine have been primarily used. For children with significantly unstable emotion, lithium carbonate, valproate, and carbamazepine may be used. If irritability is a significant factor leading to violent and aggressive behavior, consider using serotonin reuptake inhibitors. For children with other accompanying problems such as attention deficit hyperactivity disorder or depression, appropriate medications may be used. Cognitive therapy. Children with oppositional deviant disorder often struggle to use their cognitive abilities to restrain inappropriate behavior. Therefore, they need to identify problems, analyze causes, consider consequences, and find the correct method to solve problems, thereby reducing the occurrence in inappropriate behavior. Behavior therapy. Appropriate behavior correction methods should be used to gradually reduce and eliminate undesirable behavior and establish good behavior. Social skill training should also be provided to improve peer relationships and enhance social skills. Family therapy, parent-child interaction therapy, PCIT. The goals of family therapy include coordinating and improving relationships among family members, helping parents learn how to communicate with their children and use appropriate parenting techniques to educate the affected child, guiding parents on behavior corrections, enabling them to correct the child in appropriate behaviors, using appropriate methods, and reducing life events within the family and person on negative behavior. Advocate message for public. A child presenting with oppositional deviant disorder symptoms should have a comprehensive evaluation. It is important to look for other disorders which may be present, such as attention deficit hyperactivity disorder, ADHD, learning disabilities, mood disorders, depression, bipolar disorder, and anxiety disorder. And it also can lead to antisocial personality disorder, substance abuse, and even suicide, significantly disrupting social and interpersonal relationship. It may be difficult to improve the symptoms of ODD without treating the coexisting disorder. Some children with ODD may go on to develop conduct disorder. It's well known that once conduct disorder form, they are very challenging to treat. Therefore, prevention, especially early prevention, is emphasized. Research has shown that early prevention and timely intervention can prevent problem behaviors from progressing into more serious issues. Successful prevention measures include parent-led approach, training in social cognitive skills, academic skill training, classroom management, teacher training, and group therapy. So thank you for listening and watching. Bye everyone.